molecular methods are extremely sensitive in identifying bacteria, but there's a power to that. If you do a regular culture, any bacteria that gets onto the swab or gets into the sample may be amplified and grow better than what you're taking out of the sample. So for molecular identification of bacteria, what we want to do is start with sterile instruments, sterile Q-tips, and we want to stay clean. So you don't have to go to a sterile technique to get these cultures. Basically, we're going to have 10 to the 5th, 10 to the 7th, 10 to the 8th bugs, and if you get 1 to 2 to 100 bugs in there, it's not going to skew the molecular identification in any way. Now, you don't want to be bringing, you don't want to drag skin stuff or anything else into it, but at the end of the day, there's so much bacteria in the wound, it's not necessary to be just overly vigilant not to get any other bacteria on your instruments or on your swabs. Now, swab is not the preferred method. You lose some quantitation. What you're going to get is what's on the very surface of the slough and on the very surface of the wound biofilm. And we do know that biofilms are stratified. There's different players, different species of bacteria at different levels of the wound. So we don't know if the exterior of the wound correlates well. We think it does. The technique that we want to talk about now is the swab. We got lots of different tools. Again, you want to start sterile. This is in a sterile package. This is a cotton tip applicator. We provide different types of applicators because the more debris that you can get into this swab, the better, because when we extract it, a lot of this stuff can hide in the cotton. So we like to wet it. It just facilitates picking up stuff, the slough, the debris that's on the wound. I like to think of, I'm trying to debride this wound with this cotton tip applicator, and you want to roll it. You want to get as much material in and on the applicator as you can. And I'm seeing debris there. Now, blood isn't really a deterrent. If you get some blood, that's okay. And now that is our sample. So I can actually physically see debris on it. I've pushed hard. I've tried to get the slough to come off the wound. And now what we're going to do is we're going to put it in the container. We're trying not to transfer any bacteria to it. Now, some applicators are plastic and you may have to cut it with bandage scissors. Again, a few bacteria off of sterile scissors or whatever isn't going to skew what the final identification of bacteria or fungus is going to come from that Q-tip. Now you've got all the labeling stuff and it goes off into the pack and you FedEx it into the lab. Another method for obtaining a sample that we like better is with sharp tools. Again, we're going to start sterile and we're going to stay clean. The barrier that we put down, it should have very few bacteria. The instruments that we use are going to be sterile. Now, there'll be some stray bacteria here and there, but they're not going to skew the results that you get from the molecular identification. It's not going to amplify those up and make those major populations. They'll just be stray contaminants. They'll be less than 1%, and they'll not even be reported. What I do is I want to get what's up against the host. Biofilm, the wound biofilm, the species do reside at different levels. Now, we don't know what species up against the host unless we take a host sample. So what we like to do is take off the debris until we're down to a little bit of bleeding. And then the other thing we like to do is, in a small wound like this, is try to get the whole wound. Wound biofilm is not like salt in salt water. It doesn't distribute itself all the way evenly across the wound. It comes in monoclonal swirls. That means one species will reside in heavy concentration in one area, and it might be very minimal concentration in another area. So what we're going to do is get some of this, and this is mainly host tissue. This is some necrotic tissue. Now, we numbed her up good before we did this. So before you get your culture, make sure you do that. Now, this is bone. that's sticking out. And so what we'll do is we'll just pop the end of that bone off. And usually scissors is good enough. Now, molecular methods, we have ways to extract bone. We can extract nails if you do want to do fungal nails. So this is bone, and we're going to try to get that into our container. And that goes off, and that in itself can be the entire sample. And most of the time I would probably do that because that's what we're going to be looking for. Another thing that you can do is just pull the sample. And now we're down to host tissue, so I'm going to take a thin layer of the host, knowing that the biofilm is down deep. And what I want is a BB size amount of material. So that was way too little. A little bit of blood doesn't inhibit the test in any way. So this is like a tendon structure. Am I hurting you? Sorry. Okay, so I'll back off a little bit. So something that's about the amount of a curette will be more than enough sample. That'll be 1 billion bacteria for most wound beds. So that's all we're trying to do. We don't want to get a lot of host tissue, just the interface. And then again, you got all the labeling stuff, you got the kit, you FedEx that off to the lab, and you get the results back.
To request testing kits or for more information, contact the Pathogenius Laboratory.